So Little League kids get what's called Little Leaguer's shoulder, which is kind of where the growth plate in the shoulder is, and it's kind of an overuse type of an injury. It's not serious to the point where it's going to cause any permanent damage, but we probably need to slow those kids down, and a lot of it's related to just how much they're throwing, and so that's why you hear about pitch counts and things like that. So we want to try to minimize that when the kids start having shoulder problems, and most of the time it'll just go away on its own. It's rarely something that needs any kind of surgery, so that's the good news about kids. As you get into the older age kids, teenagers, young adults, then you start worrying about things like rotator cuff and labral tears. So a labrum is the cartilage between the ball and the socket, and so any kind of repetitive motion with throwing, any overhead athlete really can get injuries to the labrum, which can start off as a tear and then progress there and even get involvement of the rotator cuff over time. So if you have some aches and pains in the shoulder, particularly in a throwing athlete, and then you kind of push through it without getting it rehabilitated, you can cause further damage. So something that starts off as just a tendonitis that might be more of an overuse, if you continue to push through it, what can happen is your different muscles try to compensate for it, and that really throws your mechanics off. And anytime you throw the mechanics off, then you can lead to other injuries where it could be like a torn labrum or even a rotator cuff, and that occurred as a result of you just kind of trying to push through the activity. Well, prevention of shoulder injuries, before baseball season and throughout the season is really focused on your entire core. So everybody knows that, throwing a ball is not just your arm, it's really your core, your hips, your legs. And so strengthening every part of your body is going to be the best way to prevent those types of injuries. Specifically for the shoulder, you want to really focus on strengthening your rotator cuff muscles and even some of the larger muscles around the shoulder like your trapezius and latissimus and those types of muscles. So really keeping those as strong as possible.